Our next segment is with our WHHI General Manager, Jessa Jeremiah, interviewing Kerry Reilly from the Hilton Head Regional Healthcare System about breast cancer awareness.
Welcome back. You're watching Talk of the Town. You may know that October is Breast Cancer Awareness Month, and you're in luck because Hilton Head Regional Healthcare has a breast health center. We are here at the Bluffton campus. We're going to talk about that today, and we are joined now by a very special guest and also an employee here. We're going to talk to you today. Kerry Reilly, thank you for joining us today on the program.
Thank you for having me.
So you have a really unique story. We're going to share that with our viewers here in just a moment. First, tell us what your title is here and what you're doing.
Well, today is my first day on the job, and I am the new breast navigator at Dr. Ringer's office here at the campus here.
This is a really incredible and special title, and we're going to talk a little bit about what that means, because for our viewers at home, you're going to want to learn what a breast navigator does, I would imagine. But let's first talk about how you got here and your journey. You have a story that is a unique one. Let's talk about it.
I do have a story that's unique. I actually met Dr. Ringer 3 years ago when I started working in the operating room at Hilton Head Hospital, and from there, you know, it was time to get my first mammogram, and I had my first mammogram at 41, 42 because COVID was going on, and so there was a little delay, and I had the mammogram, had to come back for a 3D view, and then I had to come back for a biopsy, and unfortunately my first mammogram was positive. The biopsy was positive. So I became a breast cancer patient of Dr. Ringer's, and I went through the whole process, and my significant other and I came in together. We talked with Dr. Ringer, decided our option, which was the best option for us, was a double mastectomy, and I went directly to implants afterwards, and recovery was great. I'm a nurse myself. You know, I didn't need as many of special referrals and whatnot that some other patients that don't have a medical background do need. I didn't need that kind of stuff, but recovery was great. I had the surgery in September last year, and I was back working in the operating room by the 31st of October.
Wow, that is quite the story. And I don't want to skip over your time in the operating room. 20 years, I understand.
Actually, I've been a nurse for 20 years, but I was an emergency room nurse. I was in the military Air Force as a nurse. And then I've been in the operating room for 3 years.
So decades of experience as a nurse, really impressive. And what's also impressive is, you know, the process that you went through here at the Breast Health Center is something that, you know, stuck with you, made such an impact that you actually made a career move based on that. So, you know, your time, of course, was spent, you know, maybe not needing quite as many of the special treatments that some of the patients might need because of your background, but those options are available to patients. And
Yes.
I want to talk about some of those options and specifically your role here and what that means.
So my new role here as the breast navigator is to help with those options, get everything that anybody could need for referrals for their breast cancer. So we're going to empower the patient and make sure they have the resources they need, the education they need for any of their concerns. So questions, fears, and their spouses. So what I'll do is, after having our cancer talk with the patient, Dr. Ringer and myself will sit down, and I have yet to do that. I've had it done myself, but from that point, based on what the patient needs and their family, we'll go through and be with them throughout their entire surgery, their treatments, and recovery. And then years down the road, I'll be still seeing them for their survivorship meetings and many, many years of cancer-free.
You know, I have to tell you, to have somebody on your team helping you navigate something that is so difficult, not only from a health perspective, but also from, you know, what it can do to you mentally in terms of just dealing with some of the things you're going to need to go through, what that might look like for you and your family. Having somebody on the team that has been through that is something that I find would be very comforting. And so that's something very special that the Breast Health Center has here at Hilton Head Regional, is that in you. So I also understand today is your first day.
Yes.
So you have, you know, a lot ahead of you in terms of being able to help people. Congratulations. Thank you for doing that. And thank you for your interview today and sharing some of that with us.
Thank you.
We sure do appreciate it. You're watching Talk of the Town. We'll be back with more after this break.